Welcome to the first of 3 videos on analgesics and antipyretics that will be discussed in the Self-Care and Complementary Medicines course. This first video is going to discuss acetaminophen. This diagram shows where each of the products that we're going to be talking about in class actually act within the cyclooxygenase cascade. You'll see that acetaminophen acts on the COX-1 enzyme. However, you can also see where other products act. While we won't be discussing them specifically during class, the COX-2 inhibitors do have some specific action, obviously, on the COX-2, but these are prescription-only products. So acetaminophen works by central inhibition of the COX enzyme, which leads to the inhibition of prostaglandin synthesis. An important thing to remember about acetaminophen is it has no anti-inflammatory effects. So if you have a patient who has symptoms consistent with inflammation, acetaminophen may not be the best option. It has an onset of action of about 30 minutes, which is pretty consistent with the other products that we're going to talk about. And its duration lasts about 4 hours. However, extended release products can last up to 6 to 8 hours. It's rapidly absorbed from the GI tract and it's metabolized by the liver. One important thing to keep in mind here is that due to this metabolism, there's an actual potential for a patient to develop a large amount of the toxic metabolite N-acetyl-B-benzoquinonamine. And this is why acetaminophen is the #1 cause of acute liver toxicity. It's eliminated by the kidneys after that. When we talk about product packaging, it's important to note that Tylenol products had a voluntary change in product packaging back in 2011. When the manufacturers of Tylenol voluntarily reduced the maximum daily dose of their products due to increased reports of accidental dosage. So they reduced the maximum amount of day for the Tylenol extra strength to 3,000 milligrams per day and the regular strength Tylenol 325 milligrams to 3,250 milligrams per day. If we look at the traditional dosing or the normal dosing for an adult patient, it's between 325 and 500 milligrams every 4 to 6 hours. The maximum dose is 3,000 milligrams per day. And I would like you to go based on this, although you will see other reports and different references that actually list the maximum daily intake at 4,000 milligrams. If a patient consumes regularly consumes alcohol, the patient should limit their amount of acetaminophen to 2,000 milligrams per day. Additionally, if a patient takes warfarin, they should also limit their daily intake of acetaminophen to 2,000 milligrams per day. The pediatric dosing is 10 to 15 milligrams per kilogram per dose every 4 to 6 hours, and not to exceed 5 doses in 24 hours. One thing to be cautious about for patients who are larger based on weight or as they continue to age, especially into early adolescence and adolescence, their doses based on milligram per kilogram can actually push them over what the adult dosage is. So in those patients, we would want to stick with that traditional adult dosing of 325 to 500 milligrams. There are a few safety concerns to think about with acetaminophen. One of the, while significant but very rare, is a rash or called scar. And this is actually a serious cutaneous adverse reaction, which was first reported back in 2012 when they went ahead and added acetaminophen to the FDA watch list due to reports of severe dermatologic reactions. The FDA is consistently looking at this association. However, there has not been a specific association determined at this point. And then, as I mentioned before, due to the liver metabolism, we would be concerned about hepatotoxicity risks. So we really need to be cautious of patients who have underlying liver dysfunction, who use alcohol, and that would be typically more than 3 drinks per day. And also considering multiple sources of acetaminophen in a patient. So they could be taking prescription products, they could be taking combination OTC products, they could be taking just a singular OTC product, and all of this combined can quickly lead us to getting over that maximum amount per day and therefore leading to an overdose.